I'm Nils Daulaire. I'm the Director of the Office of Global Affairs at the Department of Health and Human Services here in Washington, D.C. The Department of Health and Human Services has some of the world's greatest expertise in healthcare, in health research, in epidemiology, in regulatory systems for drugs and food. And our ability to work with other countries both helps them to do a better job in terms of protecting their own people, but also make sure that what happens outside the United States borders does not have bad effects inside the United States borders. With 7 billion people moving around in the world, communicable infectious diseases have to be addressed globally. HIV and AIDS affects about 30 million people. We've got tuberculosis with 2 million people around the world becoming newly infected or sick every year. Malaria is an enormous issue. Influenza continues to be a big issue. Dengue fever, which has now come into the United States from the south, and it's becoming more dangerous and spreading. We have for centuries faced a huge burden around the world of infectious diseases. Now a majority of all premature global deaths are coming from non-communicable diseases, attributable to lifestyle, to the things we consume. Those things are now taking a huge toll in terms of heart attacks, strokes, long-term lung disease, and cancer. We have to work globally to have an impact on them. Diplomacy is, in fact, a major part of global health. The Office of Global Affairs is HHS's diplomatic connection to the rest of the world. Secretary Sebelius wanted to understand what was going on in the second most populous country in the world, India. India is a really vitally important partner and component of the global health picture. During the week that Secretary Sebelius was in India, we commemorated the first anniversary of the very last case of active polio found in India. Just an incredible achievement. When I was a medical student, I had the good fortune to spend half a year in a clinic in rural Bangladesh. When you work with people, empowering them to deal with their own problems, it's enormously satisfying. The idea of global health is that we're all in this together, that we cannot separate the health of one country from the health of the rest of the world. When we make the world a healthier and safer place, Americans are healthier and safer. For more information on the Office of Global Affairs and HHS's work around the world, go to www.globalhealth.gov.